It's a tragedy to see women in the prime of their life. 80% of scleroderma victims are women in the childbearing years. And many of them are just way too scared or way too sick because of the way they look to step forward and speak out. I want to help those people.
When Sharon Munsky came to me some years ago with her dream of setting up a center that would focus on scleroderma and bringing basic scientists that never thought about this disease together, we jumped up and down because this was a way for us to get seed money to go after novel ideas that would not be funded in any other way. One of the reasons I started the Scleroderma Center was with the lofty goal of curing scleroderma. And I asked myself, how would I go about doing that? And the first thing is, I'm absolutely convinced that our patients hold the answer to this disease.
In the beginning, I had strange pain all over my body. Strange because I was such a jock, a little exercise maven. And everything started to hurt, everything that moved, and things started to swell up.
Why can't you do this, Mommy? Well, it's the scleroderma. And they take it. They're kind of used to it now. And maybe because they were so young when I was first diagnosed, that it's just always been that way.
I thought I was just getting older and just wasn't in shape. So I started to push myself some. And then when I found out that's what I had, then Dr. Wigley told me, definitely don't push yourself, because the scleroderma settled in my lungs.
It's an unusual thing. People, my hands are physically changed and so are my arms, and people are very aware of that. And you become aware of the fact that people look and people, you know, kind of stare. They don't want to, but they do. And you can see that they want to ask questions, but they don't.
We're trying to get everything leveled out because I want to, hopefully, next year be able to start trying to have a baby. So I'm trying to get everything just balanced out. Doesn't have to go away. I just want it to start to stay level the same for a while. So I'm going to try to do that.
You know, every morning I wake up, I'm in pain. Some days it's worse than others, but you learn to live with it. I mean, you can't lay there and not get up.
I was in bed, I could not lift my head that high off a pillow. Everything just left me. And it's been a long haul. I've not had a solid meal since year 2000. I have a G-tube.
I think we're in a good day. Having a good day. So, I'm not in the hospital. I've been out for a couple months now, and I'm back to work. And
I believe that I've had scleroderma since I was probably 6 or 7 years old, but there's no way to really know for sure. So,
to have the patient understand that there's hope, that there's a window at the end of the tunnel, shakes some of the fear that you feel when you have a disease like that doesn't go away overnight, that's chronic. Shakes some of the fear away when you've been told that you're going to die with this disease.
You cannot be a wimp. You cannot baby yourself when you have scleroderma. You can't do that, or you'll just fall apart. And you need to be around people that make life pleasant for you.
I remember a patient once who was on oxygen and near the end of her life, and she told me, you know, my lungs are ready to go, but I feel good. I feel good about myself. I feel good about my life. And so whatever happens, I'm ready. And that made me feel good, because we provided her with the kind of support that allows you to do that when you're suffering so with this chronic disease.
it was a really hard summer. I was in the hospital from May 17th until July 17th. So 2 straight months, and and for much of that, about a month and a half of those 2 months, we thought that, I was probably going to die before I had a chance to have a double lung transplant. So I have a whole lot to be grateful for.